Hello, I'm Tiffany Petrie from Doctor's Clinic, and I'm here to demonstrate the use of our app that we use for Springhill Medical Center. It is called the Healow App, and this is going to demonstrate how to make an appointment and do a televisit with one of the providers. What you would do to begin this process is call the front at the clinic. You need to do a televisit with the provider at, and they will schedule you, or you can go on your app and do it if you're knowledgeable of how to do that. They will schedule a particular time. You will get an email to confirm the appointment, and once you get your email to confirm, you will be directed to download the app if you don't have it on your smartphone, or if you have the app, it will take you directly there. In this case, we have the app. So once my appointment is confirmed, I'm going to click on the app. And then it will take me to my personal information that I've set up. Anything that I have with the clinic, it will bring me here. And for this televisit, it will show up where that area is red. It says appointments. So I have one, and this is what is created after I confirm my appointment through my email. Now today my appointment is with Tommy Ann Cassidy. She's one of the family nurse practitioners at Doctor's Clinic. And once I clicked on my appointment icon, it pulled up my appointment time, where the appointment is, and then the provider. In this case it's Tommy, and it has a photograph of her. So I will click on that. It pulls up another section that gives all the same information, but at the bottom of your phone it has an orange bar, and it says Start Televisit. So I'm going to click on that, and it pulls up another page, and it says, are you ready? Start Televisit. And now it's waiting for Tommy Cassidy to join, and she will be notified that I'm online. And so my screen is right here, and there's Tommy Ann.
Hi, Tiffany.
Hey, Tommy Ann. Okay. We're doing a practice run demonstrating the use of a televisit. From the patient perspective, this is what your screen will look like. You have an option with an icon on the left for your video camera to disconnect, to turn off your microphone, or to turn the camera around. This will be beneficial if you need to take a picture of a blood sugar log or blood pressure log, or something that the provider needs to look at, whether it be something on your skin, a rash, or whatever she may need. Hey, Tommy Ann, how are you?
I'm great. How are you today?
I'm good. We were just going to demonstrate for everyone how this works. If someone needs to call in, if I were to call you or make an appointment and need my med refills, but I just saw you about a month ago or within the past 6 months, and because of all the scare, I didn't want to get out and expose myself. This is a good way, or is there any other ways that you can think of this would be beneficial for patients to use?
If someone is sick and may be concerned whether they need to come to the clinic or not, this would be a good resource. Someone who has a condition that I don't necessarily have to physically touch them, but I can see them. Maybe a skin disorder, something going on with the eyes, anxiety, depression, things like that that we need to follow up on, but not necessarily in person. I think that this would be a good option.
Okay. And from my end, it's fairly easy, and I appreciate the fact that y'all are able to do this. Dr. Sessions, how are you today?
I'm fine. How are you?
Good. We're showing the use of this app for the general public and the patients that can call. We have had several patients call who have seen this being advertised before that don't want to come in the clinic and expose themselves. Can you think of any ways this would be beneficial for you to use to help keep the public safe or the patients away from coming indoors?
I think there are lots of cases where if the patient discusses it with us, we can certainly put off for a time having them come in, and for sure the next several weeks we probably don't need to see anything but acute illness. but we can plan ahead, and we can help with medication. If you need a colonoscope or something like that, we can determine if it needs to be done now, or maybe we need to put it off. But if you'll call in and talk with us, we can certainly work those things out.
Okay. Tommy, as far as if I need med refills, you would be able to do that from your end, just from this visit?
Certainly. We'll perform this televisit just like you would in person. I'll gather the information, ask you some questions, and then send the prescriptions into your pharmacy just as I would do if I saw you in person.
Okay. Okay. And it's simple as that. If I just need to get some refills or talk to the doctor, this is one quick and easy way to do it without having to go into the hospital or the clinic or to interrupt my schedule if I'm at home with sick kids or family member. This is one of the options that we are now offering for Springhill Medical Center. So if you have any questions, we will be posting information and getting the information on how to do this, and it's beginning this week actually. We've already started with some visits.